Hi, this is Doc David Gawain, and we're going to talk a little bit about some dental issues and solutions which are good, better, and then actually best. and in these issues, what we're talking about in this case is bone regeneration and actually bone grafting. When a bone gets actually grafted due to, let's say we had cavitations and we're missing some bone because the tissue was necrotic and the doctor took out that actual infection, and then there's not enough bone in that area to grow back, many times they'll actually graft materials back, bone back on. And we've had so many successful cases of actually helping this condition. And here is a good way to get started, and that's using a soft laser. In this case, the laser of my choice at this time is called a Q1000 NG+. Simple, all we're going to do is turn it on. And what we're going to do now is actually press a mode. In this case, it's mode 1. Now, what's beautiful about the soft laser is how it adds energy to the system that we're putting it. Now, the thing about bone grafts is how do we get blood flow to that area? How do we get polarize the damaged and injured cell membranes that happen around where the graft went in? And how do we help the communication of the new cells kind of work with the old cells in the beginning? Well, light is a powerful, powerful mechanism in order to assist all those things. In this case, the Q1000 has 7 different wavelengths of light. And every wavelength has a different way that it helps the body. Now, let's say that we had a bone issue here, or even, I'm even going to say we have an infection, or even we might even have gum issues inside. In this case, I'm just going to show you how to use the laser outside, is we'll put it right on the spot that hurts. Now, the thing that's fun about that is when we put the laser directly on the body, the way this one works with this glass is it will actually stick on the area that actually needs more energy. In this case, needs more ATP. The light from the laser actually goes into the cell, then stimulates the mitochondria. The mitochondria opens up and creates ATP for the body. And we're doing that like a photovoltaic system, meaning we get light and then we get electricity out in the little photocells that some of us are starting to put on the top of our houses, or we see all in different areas. Well, your body does the same thing if it has a mitochondria. So we'll put that right on that area. And what's fun is after it gets the energy it needs, what we'll find is that area doesn't stick. Like in my case, I'm doing pretty good, but boy, does it stick there. And I have some TMJ and a little bruxist going back here, meaning I kind of grind my teeth back there. Now over here, I'm going to move it, and not as bad as over here. Now, this was horrible last week. Now, why? Because I actually had a bone infection, and I used my Q1000, and then a better solution is using a Q1000, which is a resonating laser, and I can use that on the area, but that's kind of like a watering can. In this case, we're going to add a little more energy to it, and in 3 minutes, this gives more energy than these 20 diodes actually give in 3. But this is a watering can, and this is a fire hose. This watering can is safe enough to actually put over my eyelids to actually give energy to my eyes. We have many cases of macular degeneration reversing, as well as other eye issues, but that's for a different time. So what are we going to do when we have, dental issues that we want to assist? We're going to turn the laser on, we're going to put it directly on that spot, and we're going to move it to where it sticks the most, and then we'll leave it on till it stops sticking. Now, with the other device, which is what we were just talking about, we're using an 808. Now, understand, this little 808 that I have is over 12 years old. So some people ask, well, Doc David, how long do these lasers last? Well, this laser is relatively new. It's been purchased in the last 6 months. It's the newest and the latest, greatest. And this one is was born in 2002. So what do we got, 13 years now? That's pretty good. This was born in the same year. And now I'm going to hook him up and I'm going to show you how it works. So when we have bone regeneration, we have tissue which doesn't get a lot of blood supply. And that's why more energy is better than less in this context. So we will put this right on the area outside the mouth on the cheek side where that bone needs to regenerate, or where that infection is, or where that abscess is, which of course is an infection. Now, one thing that we can do is also, very scientific here, use a plastic bag, and we can put that here, and now I can actually go inside the mouth on the area that actually needs the attention. And I'll do that for at least a cycle. And then I'll probe around, and if it doesn't hurt, I'll go to the next place. And I'll continue to do that on the area until there's no more hurting or hurts. Pretty easy. And I can always check with my laser, and I'll show you in a minute, a scanner, where all of a sudden, boom, that's where I need to do it a little bit longer. So that's one way that will deal brilliantly with where we need more blood flow, we need more nutrition, we need to repolarize damaged and injured cell membrane, we need the body to reconnect and communicate. The laser helps the cells get the energy they need to do those things. It's kind of like if you're cleaning your basement. Is it easier to clean when you're feeling good, or when you're so tired that all you can do is sleep on the couch? Yeah, it's better when we have a little more energy. In fact, when we've had some of our people come to our house to clean the house, I kind of ask them, how's your energy feeling? And if it's a little bit low, I'm going to pull out my laser to help them get up to speed so they'll actually get more done in that hour or hour and a half or 2 hours that they're spending at our home. Kind of interesting, huh? It's a way to help a friend also. So that is the good way to help. The next video will be working with the better way. Doc David Gawain, Transformational Health Services, DrEmpower.com.